Which means, Rachel, thank you. It's time for the Weekly Health Watch. As always, we're joined by Dr. Syed Hussain of Trinity Health of New England to talk about the topics that are trending in the medical world.
Morning.
Doctor, good to see you again.
Likewise.
We're starting with prescription cascade, as some people call it. From young adults who are coping with anxiety to older adults who are trying to manage a lot of different chronic conditions, prescription pills are really a part of people's daily routines, but maybe too much. Take a look at this. Overall, about 13% of the people in the U.S. take 5 or more prescription drugs. And for people age 65 and up, that number's at 42%, which is less surprising that the older they get, the more you need it. But are people just in general taking too many or taking prescription drugs, doctor? At times they shouldn't. How can they avoid that?
Yeah, it's a great question. As you know, the statistics are pretty high up there in terms of as you grow older, more prescriptions. Not entirely surprising, Tim, but the important thing here to remember is set up an appointment dedicated with your provider, dedicated to just discussing medications. Don't keep them for the last couple of minutes when things are rushed and you may not get time, or your provider may not get time to review all of the medications. Also keep in mind, you may have a primary care doctor, which you should, but you may also see a cardiologist, a nephrologist, a neurologist, a psychiatrist. So you may have other doctors, and your primary care doctor may not know all the medications you're taking. That's why I mentioned that set up an appointment solely dedicated to discussing your medications. And keep in mind, even though you may be taking a certain pill for a long time, it may now suddenly start having side effects, because as you grow older, the body changes. Your metabolism changes. So it may have drug-to-drug interactions or drug-diet interactions, which may be causing you to be more fatigued, tired, anxious. So a lot of side effects that can happen, which you may not realize may be related to all the pills you're taking. So the best thing is talk to your provider.
I imagine that's, probably would be very hard to pin down, because you would expect the side effects to happen right away. But like you said, age.
It can take a while for them to pop up.
And one other thing I wanted to ask, how does this come about often? I know it's probably different for every person. Are they getting overprescribed in the first place? Are they just hanging on to them too long? You know?
No, I wouldn't say that necessarily. But Tim, it's really important that something that you may have been started on, is it still appropriate? Do you still need it? Is there an improvement in your medical condition which warrants you to stop taking it or tapering the medication?
Right.
So it's important we look at all of that. And if you have a family member, if you have a son, a child, a grandchild, can they also assist in getting that appointment and helping you sort through what medications you're taking in? And all of that.
So there you go, a dedicated visit with your primary care provider about your prescription medications. All right, on to this next one. I have a feeling my head's going to hurt by the end of it. We're talking about Ozempic, the weight loss drug, but there's been offshoots of this that some people are calling Oat-Zempic, and now we're hearing the term Rice-Zempic. Unsurprisingly, TikTok has something to do with this. It's gone over my head. I know nothing about it. Please enlighten me, and then I'm going to wish I hadn't heard about this.
Right. So, Tim, these drugs, these weight loss medications that are now approved, Ozempic, Wegovy, and there are others, in diabetics or non-diabetics, are really, really effective. There's evidence, there's science behind them, how they work.
Yes.
Rice-Zempic, Oat-Zempic, these are nothing to do with the medications.
Okay, well,
this is a TikTok fad, where people are saying, okay, for Rice-Zempic, for instance, it's basically rice in water, lime juice added to it, and drinking that starchy water as an alternative to Ozempic, and saying, okay, the effects might be the same. First of all, there's no evidence or science to back that up.
Right.
The starchy water does not work the same way as these medications do.
Yeah.
But it's more of a social media fad, so it's important that if you are trying to lose weight, first and foremost, improve your diet. Make sure it's a high nutrient, low calorie, high protein, high vegetable diet.
Yeah.
And then have a discussion with your provider to see if you meet indications for any of these medications. So, but these fads that we see online from time to time, and we've discussed them in the past.
We have, yes.
There's really not any evidence behind how that they're actually effective.
Yeah, it takes time to build this evidence. And I think I'm going to know the answer to this question, but even if Rice-Zempic wasn't claiming to mimic the effects of Ozempic and was just alone trying to say, hey, this is a good weight loss method, is there any evidence it helps in that respect?
Look, if you take it as a meal replacement, will you feel full because of all the starchy material in that water? Sure. But will it cause the same impact long term? No. That's why I go back to the basics, which are look at your diet. Have a high nutrient, low calorie diet, high protein, high vegetables, healthy diet, exercise. It's the basics that work, Tim.
Yeah, if you want to feel full so you don't eat a lot, fiber, and more fiber. The vegetables, the fruits, like you said.
Right.
That's nature's way of getting it done. No shortcuts there. All right, Doctor, thank you so much. Dr. Syed Hussain from Trinity Health in New England. Erica is always a fountain of knowledge for us.